Last thing, what about that 4%? Yeah, 95% are pronators. What about the 4% that are supinators? It's interesting. I had a patient, horrible supinator, stands all day on concrete floors. Her feet were killing her. She was a hairstylist. She came in and said, "You are making me a pair of orthotics." I said, "You don't need orthotics. You're a supinator. You have a high arch. What am I going to do, push it up more?" She said, "Did that sound like a question?" I said, "Okay, I'll make you a pair of orthotics. I'm going to prove I'm right." 7 days after she got the orthotics, she's pain-free. Why was she right? Why was I wrong? Because as a supinator, she had a steep calcaneal inclination angle, a steep metatarsal declination angle. She was bearing all of her weight on 3 square centimeters. I went full contact with the foot and redistributed the weight over 103 square centimeters. I haven't measured it, about. In other words, I reduced the force per unit area. Then it occurred to me, what's the most effective treatment for neurotropic ulcers? Full contact plaster casting. How can you take rigid plaster and put it right against the delicate skin of a diabetic? Because it reduces the force per unit area. But don't they simultaneously get cast disease? Disuse atrophy? They can't move? What if we could accomplish the same thing? Full contact and allow them to function, while also allowing them to check their foot for lesions and treat those lesions. Wouldn't that be an enormous benefit for the diabetic and an enormous benefit for the supinator? This was the worst supinator I ever saw. And this lady had 9 pairs of orthotics. She had been to every specialist, and nobody could help her. I looked at her orthotics. You could have a party between her foot and the arch. What did we do? We went full contact, and for the first time since she was 10 years old, she was pain-free. That's what I consider an amazing result, even on the most severe supinator. What is this? Why is this so important? Because when I was in school, they said, you got to divide your patients. These patients, we're going to put in functional inserts. These patients will get accommodative inserts. No more. Now the most functional insert on the market is simultaneously the most accommodative insert on the market because it's full contact. What we basically delivered was flexibility with support. So we developed the Sole Support orthotic, and it's all based on one core value. Our core value is we make people better. So I want to thank you for listening to me and for caring enough to give your patients the best treatment available.